crazy things in the news this week. I want to talk about the Rob Reiner, Nick Reiner, and of course Rob's wife. Not the death of it. It's tragic. Everybody loves his movies. Big fan. I want to talk about the addiction side, okay? Because Nick, this accused son of double homicide, is an addict, and has been an addict since I think his first rehab trip was at 15. And over the span of his life, he's been to 17 addiction treatment centers. I can probably guess we're talking $50,000-$60,000 a month type places. Okay, so which really is insignificant, but it can actually hurt too because you get a lot of fluff. Let me just put it that way. But the most important part about that is most of these celebrity type rehabs are only 30 days long. 30 days is not enough time. But I want to talk about the family perspective here. He was quoted in an interview talking about his son Nick, where they had finally given up on treatment after 17 times because they kept hearing these professionals, as he put it, people with diplomas on their walls, telling them that Nick was a liar and a manipulator, and I'm sure they presented that in a very diplomatic way, because those are the two primary characteristics of addicts, right? But they were offended by that. Well, what's happening here? Oh, and then they said, well, Nick's the addict. It's his struggle. He needs to tell us what he needs, right? So whatever he tells us, that's what we're going to do. So what you have here is you have a family in denial like no other, and you have an addict that's literally dictating this quote-unquote recovery process, which there is none. We say this all the time. I want you to think about this, especially families. If the addict had the capacity to solve this problem, they would have done it already. If the family dynamic had the capacity to solve the addiction problem, you would have done it already. That's not an attack. That's not an offense. Families can't go out and solve cancer either. When you stop looking at addiction as a moral behavior or moral issue, a bad behavioral issue, even though that is a primary characteristic, and you start treating it as a disease with an immense amount of literature, we know exactly what's going on in the brain now, which means we have a solution.